Hello everyone, my name is Grace Smith and I am the Outreach Specialist at Durham's Partnership for Children. Today I'm going to be providing information about NCCARE360, which is a referral database available in Durham with the mission of connecting health and human services across North Carolina. We will also go over how families can get access to this resource and this database, as well as have a brief walkthrough of the database so that you can see how families can be referred to various organizations across Durham. So first, we'll be starting by explaining what NCCARE360 is. And from their website, NCCARE360 is the first statewide network that unites healthcare and human services organizations with a shared technology that enables a coordinated, community-oriented, person-centered approach for delivering care in North Carolina. This technology is powered by Unite Us, which allows organizations to send and receive electronic referrals for families in need of services. This platform was created to take away some of the responsibility of the individuals in search of services by allowing the organizations to communicate directly with one another. And that communication is through the electronic referrals. The individual who is being referred just has to be available to answer a phone call or an email from the agency that would be receiving their referral. There are many services that individuals can access through NCCARE360 and be referred for. So these include benefits navigation, education, employment, food assistance, housing and shelter, income support, individual and family support, legal assistance, mental/behavioral health, money management, physical health, utilities, transportation, and wellness. Under these broad categories are more specific needs that an agency can address. So, for example, under the education tab is early childhood education, computer and technology classes, and more. When an organization registers to be a part of NCCARE360, they must put themselves in one of these categories to ensure that individuals are being referred to an agency that will actually be able to fulfill their need. Durham's Partnership for Children is proud to be one of the many organizations included in the NCCARE360 database, and we have been a part of the database since its launch in October of 2019. The partnership is listed under the Early Childhood Education tab, so families can be referred to us to enroll in pre-K and early Head Start. In return, Durham's Partnership can refer any family for services that we do not provide. Those can be families that have come in to enroll in early Head Start and pre-K, as well as any individual or family who calls our office looking for help and services that we do not provide. NCCARE360 allows the partnership to refer families as a whole or just individuals. So we would take the information of the individual who has called the partnership or who is in our office, and then after that we can enter individual household members under their profile. And this will make more sense once we go through our walkthrough, and I will show you how we can enter a family as a whole. But first, let's talk about how families can be referred to organizations in the NCCARE360 database. So, the way families can be referred is from a health or human service organization. Again, these organizations have to be included in the NCCARE360 database in order to create a referral. Like we mentioned earlier, referrals can be done in person or over the phone, again, from any agency that is included in the database. A staff member of those agencies or organizations will collect your information to create your client profile and then ultimately to send a referral. At this point, we'd like to point out that NCCARE360 is HIPAA compliant. We'll cover this later, but families will be required to give consent for us to share their personal information with another agency. This consent must be provided before a referral can be sent. So you can be assured that your family's information is protected in this database. Families can also still refer themselves to the organizations that are included in NCCARE360. So if a family does not want to provide their information to us, they can look at a complete list of the agencies across North Carolina at www.nccare360.org/resources. At this website, each agency has their phone number and website and email listed. And families would be able to call these organizations directly to be connected with their resources and programs that they are offering. So at this point, I would like to direct us to that resource page. So again, nccare360.org/resources. I have gone ahead and filtered out our location to be Durham County, North Carolina. As you can see, we have all of our service types that were mentioned earlier listed over here that we would be able to check off that we are looking for. Or we can look at the complete list. And as you see down here, there are 38 pages that families can look at. So families would be able to click on any of the agencies and they would see the address, phone number, email address, and program website. There will also be a brief description of the agency and what they do, as well as any eligibility requirements that they may have. So again, families still have the option of referring themselves if they would not like to be referred through the database, but NCCARE360 has been created to be a resource to help families be able to take that responsibility off themselves and allow us as human service organizations to assist families with that. So this is the information that would be needed for a referral. So when a family is either in our office or over the phone, we would take their first and last name, date of birth, phone number and or email address. If a family provides both, we will ask which method of contact they prefer. And we also collect information on the best time of day for you to be contacted. Again, the phone number and email address is for receiving agencies to contact the individual, as well as the agency that's collecting your referral as well. And so families also can choose to receive notifications about their referrals at their phone number or email address. That would mean that the family is receiving a notification that their referral has been received and by which agency, as well as if their referral has been rejected. Another piece of information that we'll be collecting is an address. Families can choose to provide a work, home, or any other form of address. We just require an address because when we are sending your referrals, we will be finding agencies that are closest to the address that you provide. So for example, if a family would prefer to be placed in agencies and organizations that are closer to their work address rather than their home address, they would just need to indicate that they're going to give us their work address. To the right, you'll see that we also have optional information, meaning families can choose not to disclose this information. So that would be the demographic information, such as race, ethnicity, and gender. And then we have assessment questions that will ask more specific questions about income, health insurance, and household size. These assessment questions are catered to the specific referral that is being sent. So, for example, if a family is being referred to a healthcare organization, they would get assessment questions asking if they have health insurance and what kind. If a family is being referred to agencies that have income eligibility requirements, then they would have more specific questions asking what their monthly household income is, etc. Again, families can choose not to disclose this information, but the assessment questions are useful to the receiving agencies as it gives a better snapshot of the family before, so that the agency can accurately decide if they are able to receive the referral or if they need to reject the referral. And so our last and most important step that we talked about earlier is receiving consent from the families. Again, this step is critical as a referral cannot be sent unless we receive consent from the family. And this is to ensure that our database is HIPAA compliant. So there are multiple ways that a family can provide consent. The first would be if we are taking the referral over the phone, we will ask for consent to be received via text message or email. The families would be texted or emailed a link that would take them to our consent form, and then they would be prompted to provide their signature. If we are in person, we can get an on-screen signature in which we would show the family our consent form and then have them sign on the computer that we are taking their referral on. We can also receive, if the referral is being taken in person or over the phone, we can also get a signature on paper and then upload it into the system, or verbal consent, either from the individual or from the staff member on behalf of the individual. We prefer to receive consent in one of the first three ways, but the other two are an option, and so we wanted to list them here. So now we'll go over and look at the NCCARE360 database. So first is our network. Again, these are agencies closest to the partnership's location. We can also filter them out based off of our categories. So here you can see that there are many, many more specific needs that we are able to address. So for this example, we'll look at agencies that provide clothing and household goods. And so I am able to click on an agency to get a better description of the agency as a whole, plus their programs. And then I am able to see if they have any eligibility requirements. So Central Piedmont Community Action Incorporated requires families to reside in Chatham, Durham, Orange, and Randolph counties, and their entire household income must be at or below 125% of the federal poverty line. Now we'll take a look at a client's profile. So here we have a profile for Grace Smith. We can see all of the information that was mentioned earlier that was collected, including preferred method of contact and best time to contact. Personal information, we can see here Grace chose not to disclose her citizenship status. And we see that Grace did disclose her race, ethnicity, and gender. Now to go back to our household information, we can either provide an exact numeric count. So here we see that Grace told us that her household size is 1, or we are able to enter individual household members. So if I click add household member, I can put their first and last name, gender, date of birth, and relation. Then I would be able to refer that individual if for any needs that they have separate from Grace, as well as any agencies that are receiving Grace's referral can see that she has household members and who they are. We also see Grace did not provide any household gross monthly income information, and we are still waiting to receive consent in order for Grace's referrals to be sent. So if we were to go ahead and refer Grace for things, I would be taken to this page. Again, just as a reminder, this is just a little for your information session. This is all responsibilities that I have as the referring agency. So I will say that Grace is looking for clothing and household goods. We will browse our map. And again, we're taken to those agencies that we saw earlier. So I'm still able to click on them and look at any eligibility requirements that they have. Then I can choose as many organizations as I want to refer Grace to. So we try to refer families to as many agencies as possible to ensure that they are going to receive the help that they need. So from this point, all I would have to do is click add recipients and send. But of course, Grace has not provided consent, so none of those would be sent at this time. So this concludes the information that I have on NCCARE360. Thank you so much for listening in and learning more about this resource that is fairly new to the Durham community. I wanted to provide my contact information for you to have, and I hope that you write this down and keep it in your records. Again, my name is Grace Smith. I am the Outreach Specialist at Durham's Partnership for Children. You can see listed my phone number and email address. I ask that you, as you have families that are indicating certain needs that they have, that you keep in mind the NCCARE360 database and give them my information. Any phone call and email that I receive, I will answer and get these families into the database as long as there are agencies included that are able to address that need. So again, thank you so much for listening in, and I hope that you have learned more about this great resource that is available for families in Durham.